Great.
Okay, we are started.
All right. Good evening, everyone. Welcome to our first live webinar. So I hope this will be beneficial to those who are joining us. Forgive us if we have some glitches or screw-ups. This is our first webinar, and we wanted to connect with everyone, and I will start by saying that we hope that everyone is safe. We hope everyone, loved one and families are safe. It's certainly been other than very tough times for everyone. This disease doesn't discriminate between people. Everyone is carrying the burden of this disease, and we have certainly our share in healthcare, but definitely others are carrying their own burden. And we have been educated going through this tough time. How can we connect with patients with ways that we haven't done before? And today we are gonna go over next 30 minutes or 45 minutes. We'll try to cover in our specialty, which is treating obesity, overweight, and morbid obesity. We want to cover how this disease, how the two diseases are related, the infection and the excess weight. I want to welcome the panelists with me. My name is Rami Lutfi. I'm a bariatric surgeon at the Chicago Institute of Advanced Surgery. And I want to welcome my partner, Andres Giovanetti, who's a hepatobiliary surgeon, foregut surgeon, bariatric surgeon, everything surgeon. Andres just completed a robotic foregut and gastrointestinal surgery fellowship in Florida, and we've been so lucky that he chose to come and be part of this team. Welcome Dr. Eric Veilleux, our fellow. We are proud to have the, I believe, the only today accredited fellowship around in the state of Illinois. And Eric joined us this year, and he's done most of the work behind the scene. So I have to thank him for trying to make me look good. It's very hard for me to look good. So Eric, thank you. I will also thank Molly O'Brien. Molly is our physician assistant, and she's pretty much taking the lead in managing patients and answering all your calls. And Molly joined us a few months ago, and she already seemed to be very, very experienced, and I asked her as well to speak. And last but not least, for sure, is Emma, our program coordinator, who's a dietitian by training. And I think we all need Emma. I certainly need Emma. Maybe my kids need Emma now. Everyone needs Emma. I have asked Emma to do our next webinar that's going to talk about staying healthy in the quarantine. We all know this has been a challenge, especially to our specialty. So I'm gonna advance to the next slide, please, Eric. I just want to say the first couple of slides, I'm gonna let it for everyone to say they're part of this. If you have any questions this year, will on the right side, you can type your question, and I'm going to be looking throughout and try to answer all questions. This is interactive. You all are muted, but you're certainly not muted, and you can reach us through questions. And I believe we are going to put this recorded version of this in our Facebook page and our website, drlutfi.com. We are already building a website for the group, but now we'll just do for the bariatric portion. Can you advance the next slide? So the goal of this webinar really is to connect with you all. We have gotten so many calls from the large following that we have about the quarantine, healthy food, unhealthy food, and many other questions that I'm not gonna ruin the presentations coming up. So we want to connect with you, ask questions, let us know what you're worried about, and you all can reach us. We will send, I guess I forgot to put our telephone or email, but most of the people, I looked at the registration list, and our website is drlutfi.com. Our social media is Lutfi Forward, and you can get all our contact information. We are looking forward to the next 30 minutes, and I think Andres Giovanetti will start. Is that correct?
Let me just hand over the slides to Andres. Obviously, we understand, we're happy that you're all here to see our first webinar. We understand how hard it can be during quarantine. Many of you have found routines that have made you successful in your weight loss journeys. And now suddenly you are required to alter all those routines. And this really impacts our eating, our plans for exercise, as well as your mental health. And many of you may feel shut off from your support systems while you're sheltering in place. So with all this happening, keeping your goals in sight can be difficult. And that's why we're here. We want you to reach out to us. We want you to reach out to your support systems, and we're going to get you through this tough time. So here, I will now change to Dr. Giovanetti, and he will tell us about Corona.
Thank you, Eric, and thank you, Dr. Lutfi, for the kind introduction. Here I'm trying to share my screen. Please let me know if you can see it. Can you all guys see the slides?
Looks great.
Yes, the panel is scanned.
Perfect. So welcome all the attendees here. I wanted just to bring this first slide to all of you to get a quick introduction about what is the COVID-19. So COVID-19 means coronavirus disease. 19 is because of the year. It is very curious that it was a pneumonia that started with no known cause in Wuhan, China, in December 31st. So it was the last day of last year. And then it was an outbreak. I mean, it was declared as an outbreak of public international concern by January 30th, so 1 month after. And at the end, the World Health Organization in February 20th declared as, the name of COVID-19. So what's the current status of COVID-19 in the United States? I know that we see this every night in the news, on the TV, but we have, this is very current numbers. We have a total of 850,000 cases. And from those that has been in the hospital that we know that have recovered from this infection, we have like 77,000 with 47,000 mortality. People that have died from this disease. So in the right side, you can see the graph of the country that actually shows that everything started like around March 14, March 15, and it started increasing. And then has been kind of stable in the number of cases per day in about 25,000 cases per day. That's what we have. Those are the new cases. Then if we switch to the status of the COVID on Illinois, so we have the total of cases is 35,000. We don't have a specific data regarding the recovered patients at this time, but we have almost 1,500 cases that unfortunately have died from this disease. And when we see the same curve that of new cases that we presented for the entire United States, right now we can see that the increase started probably around the same time in March 15 and has been increasing with some peaks around the road, but still we have about like 1,500 to 2,000 cases every day in Illinois. So, but why? I mean, what happened outside the United States? What is happening? So, what we can see from other countries that started before. So here we have Spain and Italy. That those countries has been in the news all the time and has been hit very badly with this disease. And they started a little bit probably earlier than us, 1 or 2 weeks before, and they reached a peak and like by March 20th, and then they start going down, trending down. As we can see, almost is the same shape of the curve. So that's how we are right now. That's the current status of the COVID. But importantly right now in this webinar is how obesity is related with COVID. That's what we need to know. So we have some preliminary facts. Many have asked if their surgery puts them at higher risk for COVID. So metabolic and bariatric surgery does not put you at higher risk, not even if it's a lap band, a sleeve gastrectomy, gastric bypass, or duodenal switch. But obesity appears to be a risk factor for more severe disease. So what do we know so far? So I want to just go a little bit deeper on the research that we as a group have been doing this few weeks that we have been on quarantine, and trying to get all the most current data shown, especially in our country. And we have a study that was published in New York that, as we all know, has been one of the cities that has been more affected. So that says that the patients that are less than 60 years old are generally considered as a lower risk group. But these younger patients, less than 60 years old, that have obesity, it is considered as a risk factor for more severe disease. So the numbers show that patients with a BMI of 30 to 34 are like almost 2 times more likely to be admitted to the ICU. The ICU is intensive care unit and special care, as we know. And those with BMI more than 35, I mean, the likelihood of being admitted to the ICU jumps to 3.6 times. So this is some numbers that are like worrisome. So I wanted to also bring this slide. What can we find between China, Italy, and USA? So there are many studies that are trying to compare why this disease affects differently each one of these countries. And one of the explanation, it can be there are different factors in the populations in these different countries that are related with how the disease affect the people. And yes, Americans have higher BMI than those people in China. So here are the facts. Higher rate of obesity in Italy than China. That may be one of the reasons of the higher severity of the disease. United States also has a high prevalence of obesity, so preventive measures and awareness is the key in this time. So we have learned from previous pandemics like H1N1 influenza in 2009, and we have learned that obesity was identified as an independent risk factor during this pandemic, and we can predict that the similar factors can be encountered during this pandemic. Here we have another study that showed that it also can affect differently males and females, women and men, and being male and being obese give you a higher risk of more pneumonia or more mechanical ventilation problems and arrhythmias, and also give you having seen that people require dialysis more often. This is a study that was published 2 days ago that says from San Francisco that says that nearly half of the COVID patients are obese. That doesn't mean that has like really high BMIs. I mean, we know that obesity is there are many degrees, and but the data show that 48.3% of the patients have one underlying medical condition, and one of the, which is obesity. There is, just to finish this part, give you some more scientific data. So one study from France showed that also people with BMI more than 35 is 7 times most likely to require intubation compared to patients with BMI less than 25. So here I just want to switch back to my colleague, Dr. Bayot, who's going to talk to you about the symptoms in obesity.
All right. Thank you, Andres. I love the questions. Keep sending them. I'm trying to answer as much as I can. For some reason, we just got a notification from the GoToWebinar that this may shut down at 6:40. So we'll try to go fast. Hopefully it will not shut down. But if it does, we will need to go back and figure out why. This is our first time we use this particular company. So but we'll schedule until 7, so we'll be around taking questions and answering all we need to. But so I will then answer the questions myself. I type the answers, but then if we do not get shut down, I will read those questions and any other questions louder, and we will share with the audience. So we will go forward with our question and try to go a little quicker. Hopefully we will not be shut down. Go ahead.
Great. So I will go quick so that you guys can all hear from Molly and Emma. Dr. Giovannetti just told you a lot of the data that's been coming out, some of the preliminary data that we're seeing at the hospitals, but I want to explain really how this pertains to you. You know, why are the symptoms more severe in obese patients? Now, it was once thought that the adipose tissue or the fat was just the body's deposits of excess energy in your body. But what we now know is that these fatty tissues are actually very active in the body. And the fat cells, they secrete both hormones and molecules that send signals to the rest of your body. Unfortunately, these signals seem to activate cells that cause inflammation. This places the body in a constant state of a very low-grade inflammation. Now, what does this mean for coronavirus? Well, when our body tries to fight an infection, it uses those same cells involved in inflammation to fight the infection. So what we find is that the normal response of these cells that would normally fight the virus is altered, and this affects the body's immune system. It affects the ability to fight the virus, unfortunately. Now, really, it's one of the main reasons we found about why the response in obese individuals is so much more severe than others. A lot of this really matches up to what we saw earlier on with the influenza H1N1 pandemic. Now, a lot of our studies right now are still preliminary, but matching these up to how people fought that virus, we saw that there was an increase in the duration of symptoms in obese individuals, as well as an increase in the severity. And what's more is we found that the response to the vaccine for the H1N1 was not as robust in obese individuals. So really, this fight that you are going through right now with obesity is so important in the long term to keep you healthy now and in the future. Now, the good news is that weight loss and exercise rapidly restores the body's immune capabilities and defenses. It doesn't take very long. Really, only about a 10% total body weight loss will already get your body started back to a road to a normal response against the virus. Additionally, avoiding a sedentary lifestyle, getting that exercise in, is going to open up your lungs. It's going to stop any of your lungs from closing down and developing a pneumonia, which will put you at a higher risk of going into the hospital. Now, quickly, you must hear that there's a lot of talk about ventilators on the news, that hospitals, you know, they're using ventilators, they're running out of ventilators. So what's that all about? Well, people with COVID-19, they have the virus really affecting their entire body. We've seen it can affect all organs in the body, but specifically it affects the lungs, and it damages the cells in the lungs making it harder for those cells to absorb oxygen. There's also a lot of gunk and fluid that then settles into the lungs, and really the patient must work twice as hard to breathe, which becomes tiring. Intubation allows for the mechanical ventilator to breathe for you. It takes the work of breathing away, and it allows us to increase the oxygenation of the body when it becomes too difficult for you to do it yourself. As you heal from the virus, your breathing will become more and more on your own until the ventilator becomes no longer necessary and we're able to take it away. Now, as you saw earlier, unfortunately, what they saw in France for this virus was that patients with a BMI greater than 35 were 7 times as likely to require intubation in the ICU. Now, specifically relating that to obesity, why is that? Well, abdominal obesity fights the movement of the lungs by pushing up on the diaphragm from below. It also hinders chest muscle movement, making it more restricted by that surrounding tissue, and this increases your work of breathing. The respiratory muscles that you use to breathe then become fatigued more quickly. We see this, additionally with conditions like sleep apnea, where the airflow in and out of the lung becomes impaired by the excess tissue in the head and neck area. Now, all these reasons mean that people with obesity need to expend more energy to breathe effectively. And that means that they end up, unfortunately, being more affected by infection from the virus. Here you can see exactly how sleep apnea develops with the excess tissues in the head and neck area, something that unfortunately we see in obese patients. Now, how can you protect yourself here? Well, as a vaccine or medical therapy may be on the way. In the meantime, what you can do is continue to practice social distancing, because unfortunately you are in a high-risk group of individuals. Continue your hand washing and your personal hygiene, and don't lose sight of those goals. Continue your healthy eating and exercise, because any amount of weight loss is really going to make you at a lower risk with this disease. All right, now I'm going to pass the presentation over to Molly, and she's going to tell you all about our telehealth initiatives.
Let me just, one question was, I think, interesting and on many people's mind. I did answer it already, but I like to read it loud. Someone said, I did have surgery already recently, someone I know. Am I at high risk? Do I have less immunity? And I said that on the contrary, we actually do have a patient who called, who was diagnosed with COVID-19 a couple of weeks after surgery, and she feels great, and she felt that being lighter helped her coping much more. But if you did have surgery, no, you are not immunocompromised. The one thing that will tell you is if you're early post-op, like the person who just texted us, make sure you are hydrated. Dehydration will make you immunocompromised, and it's probably the most common adverse outcome after gastric surgery, whether it's for weight loss or something else. If you're not very early post-op, then make sure you're taking your vitamins and your replacement so you're not immunocompromised. Remember, weight loss surgery helps people lose bad weight, not good weight. So you're actually shedding off things that do impair good health. But we'll continue. We're going a little faster than we wanted because we're worried to get cut off. So I will have Molly continue with this, and I will do my best to keep answering the questions. Molly, please.
Right. Thank you. So as far as telehealth, what is telehealth exactly? You probably heard this thrown around a lot right now. And it is when medical providers are reaching out and speaking with patients, a lot of times in the comforts of their own home, in order to limit the exposure that they have, particularly in now's time, to such things as coronavirus. So we're going ahead reaching out to you so that you can speak to them however you would like in your home, in your bedroom, whatever you would like. So we've been offering this since about March 16th. And with this being said, copays are being waived right now. So it is a really great opportunity for those that have had surgery over, the last couple of years, the last couple of months, whatever it may be, that if you want to just check in, talk to the doctors, talk to myself, talk to Emma, whatever it may be, now's a really great time to go ahead and speak to us and ask us any questions that you might have. In addition, we've also gone ahead and offered it for those that have had surgery but have, family or friends that, are looking to go ahead and, inquire about bariatric surgery. We do have an offer going until April 30th, where we are offering an initial consult for free where they can speak with our whole team, Dr. Luffy, Dr. Vayer, myself, and Emma, and going ahead and getting them started with this process to go forward with surgery after everything is said and done, but getting started in the process as well. Now, as far as the platforms that we are using, you're probably very familiar with a lot of these different ones, whether it's FaceTime, Zoom, Skype. Doxy.me is one that is more geared towards medical professionals. It's a very easy setup, and I'll explain in a second here basically how you get set up with this one in particular. But again, all these programs are ones that we are using, are very great in that we can connect to you in face-to-face and speaking to you with each of our providers at that time. I definitely urge you, if you haven't already, to go ahead and check out our Instagram with the handle @WootFeeForward. And with these last few posts, you can see the specifics that we talk about as far as telehealth in particular. There is a post where we walk through how to get set up with Doxy.me in particular. This is actually a really great program in that it doesn't require any download whatsoever. We simply send you the link the day of your appointment. You click on the link, you're put in our virtual waiting room. And then from there, we go ahead and put you in our consult room, and you can connect to each of our providers just as if you came into the office for face-to-face consultation. So those that are looking to go ahead and get started with this process, you might ask, what does the initial consult, what does it entail? Again, just as if you came into the office, we would provide details regarding specific surgeries, go through your medical history, discuss what would be the best procedure for you. You'll be able to speak with our multidisciplinary team that includes both English and Spanish speaking surgeons. And then from there, we also will talk about your specific insurance requirements, just discussing a lot of times they require a behavioral health visit, a diet visit, all of which that can really be started in this process and not having to wait until all these additional restrictions are lifted due to coronavirus. Lastly, we're keeping in touch on a daily basis with our team, and so we encourage you to definitely reach out to us. I've included our phone number, our Instagram handle, as well as our email. So we're answering the calls just as as we normally are. So definitely feel free to give us a call.
All right. This was the one with the competition of the best laugh. I think I definitely won that. I think I had the worst picture in that group. Well, great. Thank you so much, Molly. This has been incredibly nice to learn about virtual consultation, and we do talk in our societies about post-COVID. It's just so nice to even say the word post-COVID, and whether we're going to continue those virtual consultation. We're working with a lot of the insurance companies to ease the barriers and allow people to come and see us. We get people from very far away, and virtual consultation has been working great. It's incredible how useful technology is. I think, Emma, you had the most questions to you. I can't even keep up with all the questions about diet. We will have a webinar, especially for Emma and Molly, where we're going to talk more about basically diet and exercise. I had all sort of questions. Someone just felt that the fridge is calling him, and it's interesting. I want to get a picture of that fridge. I think he's the cousin of my fridge, because my fridge is calling. I don't know if anyone can hear it now, but it is very hard to be at home with nothing much to do, and it is very challenging for our patients who are already challenged with the ability to exercise and so forth. So our heart go to everyone, obese or not, with this time of a very easy down slope, so hopefully Emma can say a few words, and hopefully we do not get cut off again next week, and we will post that. Next week will be a webinar completely dedicated for diet and exercise and healthy habits. Thank you, Emma. Please go forward.
Just to, sorry, Emma, I don't mean to interrupt, just to quickly interrupt in case we do get cut off. We do have all of your emails from you signing up. So if we don't get a chance to answer your questions that you so diligently asked, we will send you an email with an answer to those questions. Okay, sorry, Emma.
No worries. And, like you said, I'm going to try and go through these quick, but next week I will be hosting a solely nutrition-based webinar, so I can really dive into the specifics. But there are a couple of things I wanted to touch upon. And really starting by saying, I know this is a crazy and stressful time that has greatly affected all of our eating and exercise habits for many reasons. Most of us are home more, all the gyms are closed, our shopping habits and food availability are all altered. So feelings of anxiety surrounding food and exercise are very common at a time like this. And first and foremost, I wanted to emphasize that this is not a time to be starting any fad diets or feel any feelings of guilt surrounding food and exercise. Instead, using this time to instill healthy behaviors, focusing on eating to fuel our body and daily activity to provide us energy, and trying to view these healthy changes to support a healthy lifestyle as opposed to just losing weight. And so I did want to touch upon a couple of things, starting with how to shop during the pandemic and how to navigate a grocery store at a time like this. Really focusing on three major points: sustainability, cost, and of course, nutritional quality. So every trip to the grocery store, we are risking exposure. Which means being able to purchase foods that are going to last a couple of weeks and have longer shelf life is something that's going to be crucial at a time like this. I know it is easier to buy boxed mac and cheese, chips, frozen pizzas, things that we know will last longer, but having foods that will provide proper nutrition is also very important. So I wanted to highlight a couple of things you can do, really trying to buy frozen and canned products, because shelf life on these are usually a couple months. And not only buying frozen products, but utilizing freezer space as well. So if you have any meats or raw produce that you think might go bad, cutting that up and putting it in the freezer so you can use it later, that will give it a couple more months worth of shelf life. Looking for canned products, specifically canned meats, which are a great source of protein, and canned fruits and vegetables as well. Whole grain pantry staples, so things like brown rice, potatoes, oats, really focusing on whole grains because of the fiber content. Foods that are higher in fiber take longer to digest, and in return, you'll feel full for longer. So this can help limit some of that mindless snacking or feeling hungry 1 hour after eating. Some specific types of produce that have longer shelf life include celery, carrots, cabbage, cucumbers, and squash, and also buying produce that is not ripe yet, so you can have a couple more weeks worth of that produce. Cost is obviously a main factor when it comes to grocery shopping, and oftentimes dictates what we buy. So my tips for saving money are having a loose grocery list. And what I mean by this is having ideas of what meals you're going to make for the week, but having items that are easily interchangeable, so you can really take advantage of sales and buy one, get one deals. This will also help limit your time in the grocery store, which can help limit your exposure. And lastly, of course, when grocery shopping, it is best to focus on nutrient-dense foods. So nutrient-dense foods are foods that are higher in vitamins and minerals, oftentimes higher in protein and fiber, and lower in calories. So having a diet that would consist of these foods can allow you to have larger portions and feel full for longer with having less calories. I've included a go-to quarantine shopping list to give you kind of some ideas of some staples. These can all really kind of be interchangeable and mixed to make some good nutritional quality meals. Now, so the number one concern and question I've gotten since lockdown has been about snacking and how to control boredom snacking specifically. So I wanted to note, this is very normal at a time like this and can be contributed to the stressful nature of this time and the fact that our routine has changed. Our eating and meal patterns aren't regular right now. The number one tip I can suggest is practicing mindfulness. That's really going to be crucial at a time like this. And what I mean by that is identifying your hunger and fullness cues and understanding the reason behind your snacking. Are you truly hungry, or are you just bored or anxious, or is it something else? And being able to know what triggers mindless snacking. Is it a certain time of the day that you find yourself over snacking? Are you in bed? Are you talking on the phone? These things can help identify if you're truly hungry or eating out of boredom. When you do find yourself boredom eating, trying to occupy your time with something else, reading a book, calling a friend, writing down what you're feeling, going for a walk or cleaning your room, these things can help kind of distract you and might chase you away from that fridge. Not eating straight out of the bag or container. It's very easy to eat half a bag of chips without even realizing it. Not only portioning out your meals and snacks on a plate, but also sitting down at the table to eat them. This can really help you be in tune with your senses, help you enjoy your food, and can prevent overeating. Having healthy snack options on hand for when you do get the urge to snack, and utilizing individual serving size snack options are great tips as well. And lastly, staying active during quarantine. I've highlighted all the benefits that can arise from exercise to really emphasize daily activity to practice improved overall mood and energy levels, as opposed to solely for weight loss. My best recommendation is to schedule an hour of your time for exercise, and don't even write down what that would be. Decide at that day what you feel like. There's a lot of options and ways that you can stay active at home. Going for walks or runs, utilizing at-home workout circuits. The internet is going to be a great tool for this, as well as some other just at-home exercises you can do. Like I said, I will dive deeper into that going forward at our next webinar.
Emma, great point. I just got a message from someone who has asthma and severe knee pain, and I think doesn't have machines at home. So please, in the next webinar, do expand, you or Molly. I know Molly has interest in exercise physiology on exercises at home, especially for those who may not have the means or the space to have these machines. So excuse me. So let me just a couple of questions that I felt are pretty valuable here. Staying with Emma, the question just came for you. Are there certain foods that can prevent me from getting COVID? Is there any research about that?
So no one food can prevent you from getting a type of infection. However, having an overall healthy diet that's high in vitamin and minerals and antioxidants can help support your immune system. So my best recommendation is getting those fruits and veggies in. Also, having a nice sleep schedule and managing stress as well can all support proper immune function.
Great. Molly, another question just came to you. Someone just was not comfortable turning the video camera at home. This young lady is asking if we can do this over the phone. I'll let you answer that.
Yeah, absolutely. We're very flexible in whether you want to do it phone, video, whatever. The most important thing is just connecting and reaching out to us, and we can talk to you on the phone, get you started with all the insurance requirements, and then from there, we'll be happy to have you come into the office.
Great, thank you, Andres da Giovanetti. I did answer a couple of these questions, but I think it's good to answer this loudly. If surgery does not increase my risk, as I said before, someone asked if surgery increases the risk. Why can't it happen today? So if I'm a patient and I trust the doctors and the hospitals, and I don't have fear to get COVID at the hospital because I trust the safety, why can't you operate on me today? What's stopping?
So, well, yeah, that's actually a great question. I think it's very pertinent to this moment. And I think that, well, I want to just say that we as a group in Chicago Institute, we are like more than happy to have you guys as a patient, and we're like happy to get you through all the process, and we want to do your surgery. We want to help you in this weight loss process. But yes, it is true that bariatric surgery itself does not put you in a higher risk to get COVID. But there are many other factors that need to be considered in this pandemic time. So the main factor is that the hospitals around the country are in a kind of a state of emergency, where the only surgeries that are being performed are strictly life-threatening emergencies. So also, by only visiting the hospitals, you're exposed to patients and personnel that maybe have COVID, or maybe has been exposed to COVID patients, and even if they are asymptomatic, it can transmit the disease. So, and actually, that's very, very curious that you mentioned this question, because in an international webinar early today, they mentioned that if a patient that has COVID gets a surgery done, the higher or the mortality risk increased significantly. They were telling even to 20% mortality chance after having a surgery if you're COVID positive. So now the measures they are taking to do these procedures are very, very strict. So that's why that's the only problem that we have right now, and we're trying to figure out how we're going to proceed with this.
All right, we're gonna go one more if it doesn't stop. Again, this will be on our Facebook. Eric just sent me a private text saying he doesn't think it's gonna stop because we're off, we passed the limit. Great, so we're gonna go forward then. Dr. Veo, one interesting question. Since you're my fellow, I'm gonna put you on the spot here. Someone with obesity and sleep apnea apparently uses CPAP, and that's an excellent question. Worried about the CPAP machine. What should we tell these people about the safety of CPAP and cleaning the CPAP?
Excellent. Yes, excellent question, actually. As I mentioned, COVID is very much a respiratory illness. So you might imagine, is that going to affect me? Is it going to make it worse? Do I have risk of spreading it through the CPAP machine to anybody that I might be sleeping with? So first off, you should continue to use your CPAP machine, which is obviously helping you at night. It will not make your illness worse at all. You should continue cleaning it regularly, as you probably already do. Now, if you feel like you have symptoms that might be suspicious for COVID, such as fever, cough, really any of the above symptoms, shortness of breath, and you do sleep in the same room as somebody, that is when you might want to isolate yourself to another room when you're using the CPAP machine, because it does have the potential to aerosolize the virus particles more so than your normal breathing would be.
Thank you. Great. Dr. Giovanetti. Well, first, someone sent you a greeting from Venezuela. So
yeah, I saw that. I saw that.
Yeah,
Thank you.
Well,
That's
at least
awesome.
with friends.
It's awesome to have everybody. I mean, people from everywhere.
Yes, yes. Dr. Giovanetti, one very good question, and it seemed like everyone who joined us stayed with us. So it seemed like we're not either we put them to sleep or they're actually attracted to.
Yeah, some of them maybe are sleeping already.
So Andres, please, one person is asking a very important question. What are we doing to protect the patient from us? One of us could be an asymptomatic carrier. So can you talk a little bit? I know you're on the front line more than me. I'm becoming the old guy, and you're doing more the work, the emergency work. Dr. Giovanetti, what do you do to protect the patient if you or one of your colleagues may be asymptomatic carriers?
Well, yeah. Well, the first thing that we're doing is, as Molly very well mentioned in her presentation, is that we're switching we close all our offices, and we're switching all the visits to telehealth medicine. That is a new world for all of us, and maybe it's going to be some of the future of medicine after this COVID pandemic. And especially in the hospitals, where we're doing is we're wearing all the protective equipment that we also use for when we do surgeries. So that's why we just hear in the news the lack of enough N95 mask, shields, and everything. So that's what we use to protect and try to avoid the contact with the patient, especially if we know that there are patients that are not symptomatic, patients that come to the hospital for other reasons. We try to limit the visits of any of the health care personnel to those rooms and try to get them out of the hospital as soon as possible. That's what we're doing.
Great. Thank you so much. One more question here. We have about 10 minutes. This question reads, if I go to the hospital for coronavirus, will my care be any different because my bariatric surgery? Should I tell my doctor? Maybe Dr. Veilleux, you want to answer that? So if I had surgery and I think I have coronavirus and I get admitted, what should I tell my doctor?
Exactly.
Or should I tell my doctor, or I'm going to scare them saying I had bariatric surgery?
No, that's a great question. You may wonder exactly, do they need to do anything different for you because you had surgery, bariatric surgery specifically? And really the answer is no, they won't do anything different for you. You should tell your doctors at any time all of your medical history as well as your surgical history, but specifically as it relates to the coronavirus, the fact that you had surgery in the past or have recently had surgery really will not change at all the management that they do to help you out in the hospital.
Great. Molly, another question that just reads as follows. I have seen you in telehealth. Do I need to come in ever before my surgery?
Yeah, absolutely. So, we are a comprehensive care. So, obviously we want to see you and get you started on going forward with surgery. But, as we get closer to surgery, we want to see you in person just so we can do a physical exam and make sure that we're fully prepared and know everything going forward so that we can make your surgery as safe as possible. Again, that'll be once everything is safe and we get you closer and closer to surgery. So, just limiting it for right now, but again, when the time comes, we'll definitely bring you in.
Great. And I think that was a question for you, Emma. Let me just find it here, and then I have a question, but I want to. Is the nutritional quality different between raw food and vegetables versus frozen and canned? This may not be related to COVID, but I think many of our patients are starting to think, do they open the freezer or the fridge? If they eat the frozen food, would that decrease their immunity? Can you just talk a little bit about the frozen food versus non-frozen, and then canned versus fresh?
Yeah, of course. And so at a time like this, produce can go bad quickly. That's the nature of it. And we do want to limit our exposures at the grocery store. Frozen and canned produce is a great option. So when things are fruits and vegetables are frozen and canned in that processing, they are picked at harvest. So a lot of the nutrient and vitamin and mineral content is contained, especially in frozen. The only difference between raw, frozen, and canned vegetables is that because the canning process requires high heat, canned goods might have a little bit less of those water soluble vitamins, such as vitamin C and B vitamins. But they are great options, and I definitely recommend kind of folding those into your diet at a time like this.
Great. Andres, something froze. Do you see any question that I'm missing, Dr. Giovanetti?
Well, here, yes. I'm looking at one question somebody asked that if they can make an appointment with Emma because they have been stuck with weight loss in the past month. And yeah, the answer is yes, of course. we can schedule an appointment. You just need to call our number in our office, and we'll make it happen. We can help you with that, any specific and personalized recommendations.
All right, can you tell us, Emma, someone just asked, what would be the next webinar next week? We talked a little bit about it. Can you tell us, Emma, a little bit more?
Yeah. So I'm just kind of going through these questions, and I want to include content that everybody, that'll be beneficial for the public. So definitely any recommendations of what you would like to see, I can definitely do my best to include those. But really wanted to go into depth of specific foods to have on hand that might support your nutrition and health goals. So those healthier snack options, lower calorie swaps, easier ways we can stay active during this time. And I'm open to suggestions. So if anybody wants to email me or give me a call for something they'd like to see, I'd be more than happy to include that.
Great, thank you. One of my most favorite patients just typed in question. I'm going to read it loud. A number of your patients are Black. Are you and your team having any conversation about the devastation COVID has had on the Black community? Just curious. Thanks. Thank you so much for that question. We actually, I am part of the post-COVID kind of reactivation of Mercy Hospital, where I'm the chief of surgery on the south side. About 80% of our patients are African American, and yes, we are looking at this as far as our unique demographics. And at Mercy today, there is a COVID-free zone. When we do start having surgery, there will be a COVID-free zone where people will come in to surgery from a completely different entrance and not through the hospital. We have the advantage of being able to do that. And otherwise, as far as the potential social disparities and so forth, of course, at the local hospital, we don't discuss these things, because everyone gets who walks in the door gets treated the same. But definitely, we are seeing very much more problem on the south side, where we have the higher demographics of the African American at hospitals that we cover on the south side than the north side. It is heartbreaking, and we are seeing it every day. As I said, my partner, Dr. Klimbiel, who's going to be on the next webinar, she's kind of mostly at Mercy Hospital. My other partner, Dr. Quinteros, who's a colorectal surgeon and will have his own seminar, is going to be a little bit further south, along with Dr. Giovanetti at Little Company of Mary, which we're seeing difficult times. The hope is that we're able to handle whatever we can handle and equalize the field in our therapy. Thank you. Great questions, Tracy. What are you doing in the OR to protect yourself and your staff in laparoscopic case? I think Dr. Giovanetti did answer that. I'll go very quick and say that there was some concern that laparoscopic surgery, minimally invasive surgery, may carry a little higher risk than open surgery. So far, these have not been validated. We continue to feel that minimally invasive surgery provides incredible advantage, as well as robotic surgery, to the patient, and we continue to do that with the universal precaution. Thank you, Raith, for that question. I'm proud that some of the residents I trained are some famous surgeons now. And then that's a good one here. Maybe we'll have Dr. Giovanetti answer that. Do you have advice for weight loss patients who are caring for individuals who may have been diagnosed? Do you feel that, Giovanetti, that if you had bariatric surgery and your mom had has COVID, that you're gonna have any problem taking care of her that if you did not have bariatric surgery? I think that's how I understand the question. I hope I'm right.
Well, yes, if you of course, if you suspect that anybody in your close circle at home has COVID symptoms, that person initially should be tested. That's one of the main recommendations. So contact your primary doctor and see what's the closest testing center or hospital that are like offering this test. Other than that, we recommend to limit the contact and for possible transmission. And remember that the transmissions, it can be up to 14 days after the symptoms start. I mean, there are like there's a big period, there's a big window of transmission that actually we haven't defined very well. And also, just talking about that, we need to remember that the testing capabilities are increasing in our state. Hopefully, we're going to be able to test everybody that presents symptoms. And they're offering and they're opening every day new drive-through centers or testing areas that the patient can go without even leaving their car and get the test done. And they have the results in 2 to 3 days. So that's something that need to be considered, and then monitor your symptoms and contact your primary care doctor that will monitor everything.
Great. Well, we want to stay on time. Is there any one of the panelists who want to say something? Anything? Andres, Emma, Molly? All right, so I'll close, and then I'll have Eric maybe tell people how they can watch this and what's next, what's coming next week. And for closing, I want to say thank you for everyone who logged in and stayed with us. It's incredible that we see pretty much around the same number of people, and that makes me proud of these guys. I didn't do much, just moderated. So thank you, Andres. Thank you, Emma. Thank you, Molly, and thank you, Eric. We are going to try to do this at least every other week, but because of many requests, we will do next week a webinar with Emma and Molly, and maybe one of the doctors with them. And we will address more issues during quarantine. And then for this specific webinar, we're going to have it, I believe, on Facebook Live on our website. But I'll let Eric talk about it. And I really thank everyone for trusting 1 hour in their day to listen to us. Thank you. Eric, you'll close.
Great. Yes, very similar to how we notified you for this webinar. We will notify you for the next one featuring Emma. Additionally, we can see which of your questions we were able to answer during this webinar. And as I said, we have your emails. So we will try to get those answers out for any of the questions we did not get time for. We'll send them to you in an email in the next several days, okay? Additionally, you should be getting a follow-up email, and we'll make sure to have every way of contacting us in that email in case you need to get a hold of anybody who you saw today. And we want to thank everybody again for joining us for this hour. We had a great turnout, and I hope you all learned something.
Stay safe.
All right, goodbye.
Thank you. Bye-bye.